My name is Gwen. I hope you are enjoying the sessions here at Diversity in Diabetes on today. Today, I want to share with you information about health equity in diabetes, clarity, advocacy, and change. In this session, we will go over practical tips, real life solutions, and other things that make a difference when it comes to advocating for your health and health systems. So please dial in, take notes. If you have questions, shoot me a DM or an email as I'm leaving you with a guide with information that you can use at a later time. So let's get into it. Stay happy, healthy, and safe. Hello, welcome. Today, we are going to talk about health equity in diabetes. But before I begin the presentation, I would like to know, have you or your loved one ever been touched by diabetes? If so, you most definitely are not alone. Today is about understanding those challenges that are associated with the diagnosis of diabetes. My aim is to assist you in learning the journey to make it easier and also more equitable. So, welcome. My name is Gwen. I am an LPN and also healthcare strategist and diabetes educator. Today, we are going to talk about health equity in diabetes. Living with diabetes is most definitely a lifelong journey, and you don't have to walk with it alone. Being an advocate for your diabetes or your loved one's diabetes means asking for the care, information, and respect that you deserve. When you or your family ask questions, you need to be able to receive the answers and resources that make you feel comfortable and enable your health and livelihood. This presentation is going to assist you in learning how to ask questions and what you should know to assist with your diabetes management and ongoing ways to connect with resources in your community. So, what is health equity? As we have it stated here, health equity is defined as the state in which everyone has fair and just opportunity to obtain their highest level of health. Everyone should be able to have fair, decent, and adequate health care. Some factors that affect your health equity are socioeconomic factors, healthcare access, cost of care, stigma and discrimination, access to healthy foods, and of course, racial and ethnic disparities. I'm pretty sure that this sounds familiar to you. So, our goal is for you to navigate your healthcare and healthcare team so you, again, can have the highest level of care while you are on your diabetes journey. So, let's talk about what is healthcare access. Healthcare access most definitely goes along with health equity. I consider it one of the factors. Healthcare accessibility is the form of you having access to the healthcare, medication, treatments, therapies, providers, so forth and so on, for you to obtain the highest level of care that you need for your journey. Healthcare access may be limited depending on where you are, but How do we get healthcare access if we live in a rural area? If in our community there are not enough doctors or health educators to assist us in our journey? It may be difficult, but there is help and it is doable. In many communities, especially rural or low income areas, persons may live hours away from a diabetes specialist. That's why things such as telehealth and care management are so important. Understanding the barrier to healthcare access allows us to bridge the gap to have persons continue care. Inequity. What does this actually look like in diabetes? Here's what inequity really looks like. A parent who does not speak English that is given complex instructions to assist in the management of their child's diabetes. A working mom that misses an appointment because her job doesn't offer paid time off or she doesn't have adequate childcare. An older adult that feels embarrassed to ask about their insulin. These are not just isolated stories. These are everyday life and reality for many persons that care for persons with diabetes and also live with diabetes. They remind us that inequity isn't about an individual effort, but it's about the systems that need to be better to serve the population. Barriers to equitable care. Many people face multiple barriers at one time: financial hardship, lack of insurance, cultural misunderstandings, and discrimination. When healthcare feels this uncomfortable and confusing, people may tend to skip their doctor's appointments or stop taking medications. As a healthcare provider, our job is for the community to recognize these barriers and to speak up, not only on the community behalf, but the patient's behalf, so we can come together and help one another find support and resources. Patients' voices are really important. These are examples of the mom that is Spanish speaking and cannot understand the instructions given to her because they're not made available in the language that she understands. A working mother that is stressed because she has to miss work for the appointment to take care of her child without pay. Older adults that avoid asking questions because they don't want to be embarrassed. Real stories, real people. And each person in these scenarios deserve adequate, sufficient health care. Socioeconomic factors in health access. Poverty, education, and job opportunities all shape how access care is made available. Some with steady income and flexible work hours can schedule their regular doctor's appointments, but for others that don't have the flexibility, every appointment may mean lost wages and childcare or elder care costs. The more that we understand how these factors affect healthcare access and healthcare equity, we can better advocate for fairer health systems for things like extended clinic hours, child care and elder care vouchers for health care appointments, sliding scale costs to cover appointments and medications, vouchers for transportation, and other things. Even though we know some areas do have access to Uber or Lyft, but these may not be sufficient for persons depending on the type of area they live in. It's very important that if a person lives in a rural area, some things that are available in other areas may not be available in rural areas. So, again, this is when telehealth appointments, and also care management play a heavy role in health equity and healthcare access. Now, let's talk about urban versus rural health disparities. We know when persons live in cities, there may be more clinics, more hospitals, more specialists. But again, it's not always the case when a person lives in a rural community. The wait may be longer and the cost may even be higher. And this may feel very overwhelming for a person that lives in a rural area with less access. In rural areas, people may have to drive several towns away just to see a physician, or they may not have internet access for a telehealth or care management appointment. So, improving access means tailoring solutions to each situation in the community for health success. And this is a real problem. Policy and government role. So, not to be political, but for understanding, policies and law shape almost everything about healthcare. There's no denying that. From who can get insurance to how much insulin costs, and soon the prices of what our healthcare is going to cost. When governments invest in affordable care, education, and fair wages, they create healthier communities. That's why advocacy matters, not just as the doctor's office, but also as our neighbors and at the policy level. So many changes can be made that enable healthcare access and ease the load of inopportune health equity. So, please, if it is upon you to do so, reach out to your government officials, let them know your situation, and tell them what you need so you can have better health care. Empowering patients through self advocacy. This is where advocacy, true healthcare equity, takes place. When persons are enabled with the proper tools to advocate for themselves. How do we do this? We do this by preparing questions before our appointments, connecting with community or peer support groups, making your providers aware of your needs, understanding and knowing what your patient rights are, using as an advocate a teach back to ask providers to restate instructions clearly for your understanding, and also asking for materials in your language for your better understanding. Bringing a trusted family member or friend to the visits to have another set of ears and eyes for understanding of the appointment and the materials and prescriptions that may be given to you or your loved one. Community-based solutions. Some of the most powerful health changes take place at the community level. Mobile clinics, health fairs, local education programs meet people where they are, at their door. Community health workers in your area are people who live and work in your same neighborhood, so they understand how to assist and how to serve you even better. Seek out local community health workers through your local hospital or through your local social services department or Department of Health and Human Services. Solutions that empower. True equity means designing care that fits real lives, that fits your life. This might mean teaching with familiar foods and recipes that are cultural for you, offering information in multiple languages, or using plain and friendly language, having peer mentors and virtual support so you can understand easier without confusion. It makes a huge difference. Also, when people manage diabetes successfully, it builds their confidence and hope. Managing your diabetes successfully allows you to become an advocate not just for yourself, but for someone else in your community. Essentially, not only creating positive health equity, but you're assisting in a solution that saves lives. Even though this presentation is designated for the United States of America, I thought that it would be good, because I'm not sure of who's watching, to include initiatives that are global and partnerships. So, no matter where you are from in the world, health equity and healthcare access is a thing. I highly encourage you to reach out to your local health organizations to seek assistance and build solutions for your journey with diabetes. Advocacy is not just for professionals. Advocacy is for everyone. Each of us play a role in being an advocate for health equity and for anyone with diabetes. Together, we can challenge the stigma, share resources, and make persons living with diabetes feel comfortable with sharing their needs, their wants, and other things. Change starts with a small action. You attending this conference is a change. You're going to learn information, share ideas, begin to create solutions that you can share with your community. It's a hand to hand extension. Looking ahead, there is also technology that can assist in creating better healthcare equity and awareness. We are looking forward to a more inclusive care for all. Progress depends on us. We can't leave it up to others. Staying informed, collaborating across communities, and keeping social justice at the center of healthcare is pivotal. Equity isn't just a destination, it's a continuous journey. I want to thank you for attending today's session about health equity in diabetes. I have prepared for you a guide to assist you and your family and friends for your next appointment, and also to use in your community. There will be a link and a QR code attached below this presentation so you can download Health Equity in Diabetes, the advocacy guide. Please feel free to use this whenever you have a question with your healthcare provider, your healthcare team. And as always, my name is Gwen. I'm a healthcare strategist, the nutritionist and nurse. I specialize in diabetes education and resources. I'm recognized by the CDC for diabetes prevention. If you have any questions, please send me an email to diabetes at thenutritionistandnurse.health. Thank you for allowing me to share this time with you at the Conference for Diversity in Diabetes. Stay happy, healthy, and safe.